Welcome to the University of Pittsburgh's Health and Explainable AI podcast. I'm your host, Jordan Gass-Pooré, a health and science reporter. Join me as we cover advancements being made in health informatics and explainable AI for students, researchers, and healthcare practitioners interested in applications of artificial intelligence and machine learning. This podcast is produced by the University of Pittsburgh's Health and Explainable AI Research Laboratory at the University of Pittsburgh School of Health and Rehabilitation Sciences Department of Health Information Management. Headed by Ahmad Tafti, Pitt's HexAI Lab cultivates extramural collaborations with academic institutions both nationally and internationally through its research, educational contributions, and this podcast series. Hello and welcome back to Pitt HexAI, a podcast series produced by the University of Pittsburgh's Health and Explainable AI Research Laboratory. I'm Jordan Gass-Pooré, your host, and today we're going to speak with Anatea Einhorn, who's a research assistant with Pitt's Health and Explainable AI Research Laboratory. On today's episode, we're going to learn more about Anatea's work and dive into the worlds of data and AI. We're also going to talk about the future of work and the future of education in the AI age, where hybrid fields of study and hybrid professions linking science and medicine, public service, and AI are becoming the new norm. All right, so I am going to go off script a little bit, and I'm going to ask, just based on our previous chit chat in the very beginning, how do you explain what you're doing to your mom or your family members?
Great question. I think I market it as data analysis to kind of give it a whole, just one field, but also it's, studying different populations and working with them, which is hard to then kind of go into the details of how you do that and who you're researching and what you're researching. But obviously in terms of public health, it's diseases and in different countries. And then with the data portion of it, I think I just try to make it sound a little bit more mathematical and science-based for her to kind of understand. She's a very logical person. So basically wrangling data from different populations and trying to come up with solutions to better their health systems and better their health outcomes as a whole.
So, I'll be very frank that even the term data still freaks me out. And as a journalist, I use data sets and I still have to clean data sets. But just if I get too much in my head, it really freaks me out because I was never good at math. So I am curious what your feelings are, because I imagine that you have to be pretty good at math to be doing what you do. How you feel about math? Have you always liked it?
So I have not liked it. I actually in 7th grade started to like it because of a teacher, not like it, but I became familiar with it and I felt confident with it. I wouldn't say like it still, it's a very hefty term, but I started to understand it. And then in college was when I started taking a lot of statistics courses. And it was funny because I didn't really ever, the math portion of it was great, but the wording, it was always, and stats is all about, word problems basically. And even now what I'm doing, it's all word problems basically. And it's inputting these variables of like different populations. And it's kind of giving you questions, but with very lengthy and wordy questions about that you have to utilize math for. But I started kind of looking and like piecing everything together. And I realized that statistics made sense to me somehow. I still don't love them, but I think when you just kind of look at it as like, everything's kind of the same. Like even if it's thousands of hundreds of, patients or populations that you're looking at, or you're looking at 5 people, it's still, that's just your set, and I think with these different softwares that we have now that you can just input everything into, that scale gets taken out for you a bit. So you're like able to look at it from a different perspective a bit, and it just kind of shrinks everything in a sense. So I still don't like love it from the sense of like I am so excited about like doing math, but it makes sense when now you put it into perspective of people and populations and the fact that it actually is real. They're real people involved in this. And then when you're able to work with those people too and get that data firsthand from them and collect that, that's kind of what brought it down for me and made it kind of more enjoyable.
Definitely. I've only taken one statistics course in my life because the J school I was at required it. And I think I ended up think I got a B. I don't think I got a C in that course, but I didn't, it wasn't my favorite course at all. But I like the point that you made because doing journalism, I think I'm more interested in statistics when you're actually collecting the data by being able to talk to the people that are the data. That's more interesting and makes me enjoy statistics more. So I do want to ask too about how AI has changed throughout your educational experience with statistics or with data collection. And like, when did you sort of first notice that AI was coming into play in your classrooms and you were being taught different things around AI?
Yeah, so in college, so I was doing a statistics minor, and one of the courses for the curriculum required that we take data science and statistical learning. And that wasn't necessarily AI, but that was the first kind of intro into machine learning a little bit. And then I kind of got interested in on the side because crypto became a really big thing. And I just started reading about the different technologies behind it. And one of those was blockchain, which then I got interested into seeing how maybe that could fit into healthcare. And there wasn't a lot of research around this, and I didn't really pursue it, which I'm still a little bit upset with myself about, but how blockchain could be implemented into healthcare and especially with records and helping with patient data and just in treating like the misinformation or biases within data, like imputation into systems and like health electronic systems. And there wasn't a lot going on then. I haven't really caught up to it now, but now obviously I'm working in it in a different way. But that was kind of my first initial interaction with it. And then now, as I've been doing my master's, again, there was a lot of statistics coming back into play with like data management and data analysis and data-driven decisions and all of these things that, were able to then be predictive. And so then when I started working with Hex, I, was putting all of those things together. And now I'm doing a data science certificate too, which has kind of shifted how I look at even like the public health aspect a lot because it's just easier to, I think, put into perspective like what can be done and it's not left as much in like the dust anymore. Whereas I think that, a lot of it is like you collect this data and it's like, where does it go? And like, why did you even do it? Whereas with these like predictive models, now you can start to see like some change coming out of it. So I think now it's definitely been in this master's with like now doing the data science certificate and having the experience to be able to work with different populations. Like now it's kind of really all come together, but the first initial one was definitely college.
All right. Yeah, I do also as an aside, because talking to other academics about this topic, I've had numerous academics tell me, can you please stop calling it artificial intelligence or AI because it's actually not intelligent. So I'm just curious, as someone who is currently in school, do your teachers use the term AI, artificial intelligence?
They do, but it's also more still based in like machine learning. And I think that that's the thing that my professors make note of, or now it's machine intelligence or, but the fact is that they want you to understand from a baseline of the background of it and like what it's rooted in. And that's machine learning. And that's the coding behind it. And that's the types of statistical calculations that need to be made within these codes. And I think that's where it gets really confusing when everybody is talking about AI, but like AI is not just like this one thing. It's a bunch of, once again, different, mathematical computations and calculations that are coming together. It's a lot of code and a lot of it I quite frankly don't understand, but I understand what I'm doing and I understand, fundamentals. And so it's, yeah, and I think it's gets really confusing. You're very correct in that it isn't by itself intelligent right now. It's, made to be predictive more so, I think.
Yes, I've had numerous people tell me, because I love 2001: A Space Odyssey, saying we are not at the HAL level yet, Jordan. This is not the same thing that we're talking about here. So I get it. I have been trying to not say AI, but but yeah, you're right. Like people don't understand what you're saying if you're not saying AI. So
Right.
anywho, but thank you for that. And I just wanted to take a step back though And I'm curious what got you interested in public health to begin with.
Yeah, public health for me, it was actually a passion of mine since before college. I wanted to pursue public health going into college. Pitt didn't have a program for it where I completed my undergraduate studies. Now they do. But yeah, they didn't have a program for it. I think I was super fortunate enough when I was younger to travel a lot with my mom and just saw a lot of different populations already from a younger age. One of the first, I actually wrote about this in my application to NYU, was about when I went to Venezuela when I was super young, and there was just the extreme like levels of poverty that I saw, and like the only thing that I could think about for the rest of the trip was like what we could possibly send back to them when we came home. When I was like asking my mom to like make soup and like send it back, and she was like, we can't do that. But I've just always like, it sounds really redundant, I feel like, when people are like, oh, I want to help people, but I really have always just enjoyed. I'm a very social person. I'm very outgoing, and I really like meeting different cultures and really immersing myself in that. And so, not just going to go to the beach somewhere. I actually really, I feel like I make a lot of friends when I travel that, give me insights on the culture there, the state of the country that they're in. And I think since that, and also the fact that my mom and both my parents are Polish, so I grew up going to Poland a lot. So I had these two different perspectives of like a very European mindset and then like a very American mindset. So I think those two combined.
Unlock the future of AI at Pitt HexAI. Pitt HexAI is where the brightest minds at the University of Pittsburgh come together to push the boundaries of artificial intelligence. Tune into the Pitt HexAI podcast to hear experts discuss cutting-edge AI research and its real-world impact. Join us at Pitt HexAI and listen to the podcast today.
Thank you for that. Yeah, I know 3 words in Polish in case anybody was interested in that.
Oh,
I'm not going to pronounce it because, well, it sounds terrible. My accent, all I remember are 3 words.
Okay, perfect.
Yes. Talk. Okay, there you go. That one.
There you
I
go.
think is fine.
Super.
Yes. Yes. I'm also curious too about what is the difference between public health and individual health when we talk about these two terms? What does it mean?
Yeah, I think individual health is you're really focused on one life and one person's life. And the biggest thing I think I like to say is that individual health you can't really monitor whether or not that person is going to keep up the necessary actions and steps that they need to get themselves back to what you believe they should be at. The minute they leave the hospital or like a treatment plan, like you can't really say what they're doing. They can come in and tell you, oh, I've done X, Y, and Z, but like you don't see those same results and you don't know what they've been doing. Whereas public health, I think, tries to monitor a lot of the different aspects of not only the people within a population or a society or the whole globe, but it focuses on every other aspect that is influencing those people's daily lives. So education, politics, economy, water source and sanitation. And ultimately it's to, ensure that everything is changed culturally. So around that specific population, what are their needs? Whereas an individual need is kind of at the same baseline, but within a population or a culture, they change drastically, especially with, their resources too, like what they're able to use. So I think that's kind of my differentiation, but they're obviously interdependent. So you have to kind of go off of one to get the other, but.
Yeah. And so you had said before, so you are from Pittsburgh, you went to Pitt for undergrad. But you're currently doing work at Pitt's HexAI lab, right?
Yes.
What are you working on with the lab?
So currently working on a project in adverse predictable models for adverse effects of orthopedic surgeries. We're doing current papers on total knee and hip arthroplasties, and then the next one will be shoulder and spine. So that's helped me really kind of combine my like clinical direction and passion with AI and also public health. So it's been super interesting.
How did you get involved with that work with Pitt's lab?
Yeah. So I think that, well, the one thing is I wanted to do clinical medicine. I actually really loved orthopedics, and I worked with an orthopedic surgeon at UPMC, did research for him throughout college. And when I started kind of bringing in my public health knowledge and my affinity for stats and tech and everything else, I landed here. And although it is clinical, it's also extremely tech forward. And it's now, because these are predictive models and because these models are things that we want to be fair and explainable, and for these different projects, the aspect of public health then comes in a lot when you're working with different even patients within the US and just looking at different factors that you can put in to make it more fair and explainable. So the introduction of like social vulnerability index or geographic location where that patient is living, and all of these things can have an impact on their health. So that all kind of ties in together, even though you're not really looking at that to start with. So
No, I think that's really interesting. And I'm also like really glad that you mentioned explainable a couple of times, because I think that's a good segue into talking about explainable AI. You know, on this podcast, we do like to focus on explainable AI. And you did mention explainability a couple of times in your last response. And so I would love to get your take on explainability and where you see advances being made in the field.
yeah, so I think for me, explainability is ensuring that people understand it, understand what the models are doing and what the AI is doing in terms of what the model is trying to accomplish. And it's understandable to people that don't work within it, right? And it's understandable on a level that people aren't thinking that this is taking over everything, but more so that it's helping them, especially in terms of physicians. I think there's been a lot of discord with the way that some projects come out and, you know, this model is going to do this and like robots are going to take over everything, but that's really not the point. It's how much you can reduce, you know, maybe surgery or like a risk factor for a specific patient. And it's not necessarily about that a model is going to be taking over, right? So I think that's what, for me, it would be. It's making sure that people understand the basis of it and what it's doing and making it translatable, if you will.
How do you assuage like those concerns, especially from physicians?
That's something I think, you know, when you're working with different, I think it's important that you work closely in contact with different physicians and you work closely in contact with different, I mean, professions all over, it doesn't matter within anything that you're doing. And kind of taking everybody through each one of the steps of what it is that you're doing when you're starting to create these models. And then just like I was saying before, when you're studying different populations, it's what that population specifically needs. And there's no difference here. So, you know, going into a clinical setting and asking the physicians, first of all, also what they are struggling with, what's something that is, you know, not being produced, what's something that is kind of, you know, making them trip up, if you will, and then kind of really adapting to that specific climate and adapting to that specific like issue that they're having and tailoring the whatever model or, you know, this explainable situation to their specific needs. So I think that once somebody is taken through the whole process, like start to finish, and they're involved in it, I think that people also feel like they're, again, same thing in different populations, when they feel that they're being involved in this and that they're being heard in terms of what they need to be produced or what an outcome that they're trying to gain is, then that's when I think it becomes easier for them to interpret and understand also this like kind of unknown area.
Yeah, no, totally. Like, I mean, actually talking to people, like, I think that even in my industry, even in journalism, finding it difficult at times of like, you actually are taking the time to talk to a population that you are covering as well. Like, I think sometimes people miss the fact that, actually talking to people is very helpful and can gain trust. And, so thank you for mentioning that. Thinking ahead to the future and after you graduate, where do you think that public health and where do you think that this industry is headed? Like what, just sort of, I know we're not psychic and we can't tell the future, but if we're thinking right now, predicting what the industry might look like.
Yeah, I think there's a lot of different companies and, startups, especially that are focused in, with biotech and public health. They're already, there's a lot of different up and coming projects. However, I think that there's a lack of this type of like job and positioning within these companies. So the future is like it's very much like on the horizon, if you will, with in terms of like integrating these different fields, but the application process and like the different types of positions that are being offered are not necessarily very integrated. So with that, I'm saying, a position that you're applying for might be, a data scientist or a computer or software engineer, but it's like at a public health focused, company, and they're working with different populations, but they need just one specific type of person, but then they want you to have like a larger outlook, right? So I think there's a lot being meshed, but there's a lot not being meshed in terms of like how jobs are looking. Makes sense.
Yeah. So I heard that you went to Nairobi and that you did a really cool project there. I'd love to learn more about what that project was and if you plan on doing any more work in Africa.
So this was a really cool course that I was able to do. It was a partnership between NYU and then Strathmore Business School, as well as the UNICEF Eastern and South Africa Regional Office. And it was working on the behavioral communication strategies for global epidemics. So it was a course, but it was also a project where we basically were asked to come up with different intervention strategies for the local cholera outbreak. And at the end of the course, like one strategy won, which I was very lucky for that to be my team. But it was super interesting just to work with already working professionals because you did have this kind of feeling of imposter syndrome while also getting a lot of really great work done. And then we went into the community. We worked with community health workers in one of the biggest slums of Nairobi. And we worked with different patients and collected data from them. And like I was saying, we asked them what they were in need of and what was missing from their current health system and their current care. And as for whether I would like to go back, I absolutely would. And I think there's a lot of, great connections that were made. I think there's a lot of opportunity to now integrate what I've learned from NYU and Hex to kind of implement these different types of, whether they're AI and predictive models or whether it's just something learned from a class even and implementing that into current systems already in place and working with those countries to kind of see how they can be adapted culturally and how that would work within a specific country. And I think that is something it's, again, not every country has access to internet and not every population has access to, various different resources. But I think it's somewhere that I could see myself definitely maybe, looking more into and trying to maybe spearhead that if it's not already being done. So
That's very cool. Yeah. I wish that my university, my undergrad offered a program, something like that. That sounds great. Thinking through about your trip and what you learned during that trip, because I mean, for me and my experiences traveling abroad as a student and as a student journalist, I really kind of like a light bulb moment, for me at like 19, the first time I went abroad as a student journalist, where it was like, we aren't that different from anyone around the world. And it was, the realization that it's so important that we form these connections between, myself or Americans and other countries. And it really just changed my worldview when I was an undergrad and got to go abroad for work for the first time. And so I'm curious at what you learned and like what you think about that idea of building those connections, especially as a student and early on, and like how that might have changed your worldview.
Yeah, so I mean, I think that's one thing that I always value a lot. And I think I mention it a lot day to day, honestly, in how if we're not interacting with people from other countries, we're not ever going to be able to understand what it is that they need or what it is that we need, and also learn from each other. And I guess it is extremely important that, we go on these trips and that you're not going on this trip to implement something that works in your country and just try to, force something upon another nation or culture, but help them become self-sustainable. And so help them implement different strategies that work for that specific population. And again, understanding those populations from a personal level and not just looking at, like, we were talking about data. You're not just looking at these random, numbers and statistics. You're learning how they live, and you're learning what they have, what they need, what they don't need, what works for them. And that's super important to then have these models that, are ethical, and to have these projects in order for even like AI and tech and its implementation into different fields to progress, that needs to be understood from a baseline level and not from something, that you just saw as a statistic.
Yes. And thinking too about, I think this is a really good segue into a question that we ask all of our guests in closing. We ask all of our guests to offer students a research project idea. So if there's something that you'd love to see other students work on, I'd love to hear it. And I'm sure the students that listen to the podcast would love to hear it too.
Yeah, I think that for me, what it is, and especially in terms of public health and seeing this from like a population perspective, is really bringing ethics and inclusion and these, I think, like one-on-one perspectives of these different populations into models. And so obviously I know it's hard sometimes when you're working with like clinical data that's already been just like provided to you, but even like in order to then kind of continue on with this like idea of like fairness and explainability, maybe, I don't know, making it kind of a staple to include an interview with somebody that has had one of these surgeries that you're working with, if it is in terms of like orthopedics, right, that I'm working on. Maybe understanding what that person has gone through, even if it's just one, to give yourself a kind of better perspective of, you're not just somebody that's working with the data. You're not just like the person you're understanding like the whole project of what you're doing. I think a lot of the issues with that stem from everything and is especially in the world of tech, is that people don't understand, or just anything that anybody's working in. It stems from the fact that people don't know what they're working towards, or why they're doing it. And so it creates this really weird sentiment of just like not knowing what you're doing and not really then caring about what you're doing, because you're not really fully understanding the scope of what it is. So I think integrating that kind of really personal aspect into whatever project it is, whether or not it seems like it, like you should, because there always is a very personal component to it, especially when you're working with any human data. So I think that's something that I've tried to kind of do myself. It's not been like mass implemented on any scale, but I think that that's something that at least I try to understand from my own perspective for myself. But I think that that should be something that's like done on a team level, or, entire organizational level. Yeah.
No, that's great. I totally agree with you. And this is something very similar that I've told folks in journalism too, my fellow journalists, is, interrogating really like why it is you're doing what you're doing. And if you don't know why you're doing it, I think you need to take a break and figure that out before you move forward. So yes, I think that's something that all across the different industries we can all take to heart. All right. Well, it has been an extreme pleasure talking to you today. I really appreciate your insight. And thank you so much. I think people that are listening are going to get a lot out of this interview. So I appreciate it.
Thank you so much for having me. It was really an honor, and I'm very excited to hear what people have to say.
Thanks everyone for tuning in and for following the show. The Health and Explainable AI podcast is produced by the University of Pittsburgh's Health and Explainable AI Research Laboratory at University of Pittsburgh School of Health and Rehabilitation Sciences Department of Health Information Management. I'm Jordan Gass-Pooré. Thanks for listening.